They're draining their savings, maxing out credit cards, and putting their futures on hold just to take care of the people who once took care of them. Elder care is breaking families financially, and the numbers are only getting worse. But is there a way out? In this video, we explore the real cost of growing old and the urgent question every family is now asking: can we afford to care for mom and dad? And across the country, millions of families are silently struggling under the crushing cost of elder care. Behind closed doors, adult children are working overtime, juggling full-time jobs and caregiving, watching their own savings disappear just to make sure their aging parents are safe, clean, and cared for. Some are dipping into retirement funds. Others are putting off homeownership, delaying children's college plans, or going into debt, all because there's no affordable alternative. And what's even more heartbreaking, many of these caregivers wouldn't change a thing about stepping up, but they're starting to wonder, how long can we keep going like this? Today, more Americans are spending more on elder care than on their own future. And with rising healthcare costs, longer life expectancies, and a shortage of long-term care options, the pressure is only intensifying. In this video, we'll uncover the full scope of this crisis. What's driving the cost? Why families are paying the price? And how the system is failing those who need it most. You'll hear real stories from people living it every day, and we'll explore potential paths forward. From small practical tips to systemic solutions. Because this isn't just a personal issue, it's a growing national emergency. And if we don't start talking about it, we'll all pay the price. When people think about aging, they think about slowing down, retiring, maybe spending more time with grandkids. What they rarely think about, until it's too late, is the staggering price tag attached to getting older in America. The cost of elder care is rising faster than most families can plan for. And unlike the one-time expense of a car or a home, this is a cost that comes back month after month, often for years. Let's break it down. For those trying to keep loved ones at home, in-home care is often the first step. A part-time home health aide costs an average of $26.00 to $30.00 per hour. Just 4 hours a day, 5 days a week, adds up to over $2,000.00 a month. For families who need around-the-clock help, the total can reach $10,000.00 or more per month. If in-home care becomes too difficult to manage, families often turn to assisted living facilities. These offer housing, meals, basic medical support, and help with activities like bathing and medication. The national average? Around $4,500.00 per month. And that's before adding memory care, transportation, or personal assistance. More advanced care, such as nursing homes or skilled nursing facilities, comes with an even heavier financial burden. A private room in a nursing home can cost over $9,000.00 a month, or more than $100,000.00 a year. And if a loved one requires memory care for conditions like Alzheimer's or dementia, costs can increase by 20% to 30% more. Now here's the part that catches families off guard. Medicare doesn't cover long-term care. It may help with short-term rehab after a hospital stay or limited home health services, but it does not cover ongoing help with bathing, dressing, or long-term facility stays. That leaves families with two options: pay out of pocket or spend down assets until they qualify for Medicaid, which often means depleting a lifetime of savings. For a family with aging parents, this isn't just a budget concern, it's a crisis. Suddenly, retirement plans are paused, college savings accounts are raided, credit cards are maxed out, and adult children already managing their own financial pressures are now caregivers, coordinators, and often emotional lifelines. This isn't just about money, it's about survival. The pressure to do the right thing often comes with no roadmap and no support. Many caregivers feel guilty hiring help even when they are burning out. Others take on second jobs or quit their careers altogether, only to find that their new, unpaid full-time job caring for mom or dad is far more demanding. It's a quiet collapse happening behind closed doors, in households that look fine from the outside. And the hardest part? Most people assume they're the only ones going through it. But they're not. This is a growing crisis that affects millions, a crisis that's hitting every income level, every region, and every generation. And without change, whether through policy reform, community support, or affordable alternatives, the question isn't who will be next. It's how much more can we take before the system breaks entirely? Because families aren't just losing money, they're losing time, stability, and in many cases, hope. Once the elder care bills start arriving, families quickly realize this isn't just about covering monthly costs. It's about rearranging entire lives. For many adult children, that means walking away from their careers. Some reduce their hours to part-time. Others leave the workforce completely to care for aging parents full-time. What starts as a few doctor's appointments a week slowly becomes bathing, feeding, managing medications, and coordinating care around the clock. The lost wages, retirement contributions, and career progression aren't just temporary setbacks, they're long-term financial wounds. And it's not just one person making the sacrifice, it's entire families. Multi-generational households, once thought of as a solution, often find themselves stretched to the breaking point. One household now supports 3 generations: grandparents in declining health, middle-aged caregivers trying to keep up, and young children who need time, attention, and resources of their own. Savings accounts vanish. Emergency funds are emptied. College funds are deferred or canceled, and the stress builds, not just financially, but emotionally. Then there are the hidden costs that rarely get mentioned on paper. The gas money for countless medical appointments. The co-pays for medications that insurance doesn't fully cover. The bathroom renovation to make it accessible. The stair lift, the walker, the fall alert system. The extra heating bill because mom is always cold now. The meals delivered when no one has time to cook. Each one seems manageable in the moment, but together, they drain families dry. Even the emotional toll has a price. Dreams of retirement get shelved indefinitely. The trip you were saving for becomes an afterthought. Hobbies disappear, friendships fade, and the caregiver, once full of hope and direction, finds themselves simply surviving. There's a quiet heartbreak in watching your own life shrink while you give everything to preserve someone else's. And yet, there's love there too, a fierce loyalty, a determination to show up, no matter what it costs. But it shouldn't have to cost everything. Most caregivers don't regret helping. What they regret is the lack of support, the silence from the system, and the fact that doing the right thing means losing your financial footing. It means falling behind while everyone else your age moves forward. It means being seen as noble while quietly drowning under the weight of it all. And the worst part? These sacrifices are often made alone. There's no paycheck, no benefits, no recognition, just the mounting guilt of, am I doing enough? And the anxiety of, what happens when I can't do this anymore? Families are stepping in where policy has failed. They're plugging holes in a system never designed to support long-term elder care. And every time someone quits their job, burns through their savings, or puts off their future to care for someone they love, they're paying a price we can't afford to ignore. Because this isn't just a family issue. It's an economic one, a public health one, a generational one. And unless something changes soon, more families will face the same question. How do we keep caring when we're falling apart ourselves? Behind every statistic is a family with a story, one that rarely gets told, because financial devastation from elder care doesn't always make headlines. It happens quietly, in kitchens and living rooms, through whispered conversations and sleepless nights. And it often starts with love. Maya never expected to choose between her father's care and her daughter's college tuition. But after her dad was diagnosed with Parkinson's, the in-home support he needed quickly drained what was left of her emergency fund. She tried to juggle everything, working full-time, managing his medications, handling the doctor appointments. But when his condition worsened, she cut her hours in half to be home more. The paycheck shrank. The bills grew. Eventually, they had to refinance the house. Then came her daughter's senior year. A scholarship covered part of the tuition, but not enough. Maya was faced with a choice: send her daughter off to the school she worked her whole life for, or hire overnight care for her father, who could no longer safely be left alone. She chose her father. "And I would do it again," she said, holding back tears, "but I'll never forget the look on my daughter's face when I told her we couldn't afford it. That moment broke me in half." Then there's Robert and Elaine, a couple married for 47 years. When Elaine was diagnosed with early-onset Alzheimer's, Robert promised to care for her at home for as long as he could. They dipped into their savings to modify the bathroom, installed cameras for safety, brought in part-time help when the wandering started. But eventually, it became too much. Robert hadn't slept through the night in over a year. The cost of care had eaten through nearly everything they'd saved. He was 72 and found himself filling out job applications, again, not for purpose or passion, but to keep the lights on. When they could no longer afford the mortgage, Robert sold their home of 35 years. "I stood in our empty bedroom and just cried," he admitted. "I knew the walls didn't matter, but it still felt like I was losing everything. Our history, our peace, our future. These are the stories we don't see. But they're everywhere. They're the coworkers who suddenly look exhausted, the neighbors who quietly move in with their parents, the couple who stop going out or taking vacations. It's the family juggling school drop-offs with hospice appointments, the middle-aged daughter crying in her car after managing bills, medications, and a difficult conversation with a parent who doesn't remember her name. But these aren't extreme cases. These are the new normal for millions of Americans. And yet most of them suffer in silence because elder care is still treated as a private matter, something to figure out quietly, something to handle without complaint. But the cost isn't just private, it's generational, emotional, economic. And families are falling apart trying to hold each other together, and it shouldn't be this way. Because love should never be punished with poverty, and care should never come at the cost of everything else you've built. If it feels like families are doing everything right and still falling behind, it's because they are. The truth is, the system that's supposed to help aging Americans and their caregivers, it's broken. And it's been broken for a long time. Across the country, most communities don't have enough affordable elder care options. Wait lists for public or nonprofit facilities can stretch for months, even years. In-home support is often out of reach for middle-income families, not poor enough to qualify for aid, not wealthy enough to afford private care. And assisted living or memory care, it may be available, but that doesn't make it accessible. For those who try to apply for Medicaid, the process is often confusing and painfully slow. Many are required to spend down nearly every asset they have, sometimes selling homes, draining savings, or giving up financial independence altogether, just to qualify. And once they do, they may still face wait lists, low reimbursement rates that limit care quality, or facilities that simply don't have the staff or resources to provide the kind of attention their loved ones need. Meanwhile, private insurance policies, even long-term care plans, often come with restrictions, exclusions, and caps that don't match the actual cost of care. Many policies require that you need help with multiple activities of daily living before benefits kick in. Others deny coverage for cognitive decline or only offer partial reimbursement. The result? Families who thought they were prepared are left scrambling. And all of this is happening while government policy has remained largely stagnant, even as the population ages at an unprecedented rate. Millions of Americans are living longer, but they're not always living better. And the systems designed decades ago to support retirement, health, and care haven't kept pace with today's realities. We're using outdated blueprints to solve a crisis that looks nothing like it did 50 years ago. In the 1960s, when Medicare and Medicaid were introduced, the average life expectancy was around 70. Today, people are living well into their 80s and 90s, and many are managing multiple chronic conditions for decades. That's a good thing, But it also means longer periods of care, higher expenses, and more families stepping into roles they never imagined they'd be in. And still, elder care is treated like a luxury, not a necessity. There's no universal system for long-term care in the US, no guaranteed safety net that ensures aging with dignity. Instead, we've left it to individuals and families, hoping they can figure it out, pay for it, or sacrifice enough to make it work. This patchwork approach doesn't just hurt the elderly, it hurts their children, their grandchildren, entire generations trying to balance care with careers, financial goals, and emotional well-being. It creates a ripple effect that touches housing, healthcare, labor, and education, and it leaves people feeling not just unsupported, but unseen. So when families say, "We're trying everything, but it's still not enough," they're telling the truth. Because right now, this system isn't designed to help people thrive in their later years. It's designed to survive them. And that has to change, because the longer we wait to fix it, the more families will continue to fall, not because they didn't care, but because they cared too much in a system that cared too little. So with families breaking under the pressure and a system that hasn't caught up, the question becomes, is there a solution? The answer is complicated, but not hopeless. For families who are planning ahead, early financial preparation can make a difference. Sitting down with a financial advisor in your 40s or 50s to discuss future care needs might not be top of mind, but it should be. Long-term care insurance is one option, though it comes with trade-offs. Premiums can be high, and not all policies cover what people assume they will. Still, for some, it can mean the difference between choice and crisis down the road. For those already in the thick of caregiving, there are resources, often underused or unknown. If the elder is a veteran, the VA aid and attendance benefit may help offset costs for in-home care or assisted living. Some states offer Medicaid waiver programs, which provide home and community-based services to help keep loved ones out of institutions, and many communities have nonprofits offering transportation, food, or caregiver relief. The challenge is finding them. That's why connecting with a local aging agency can be a game changer. There are also creative community-based solutions making a quiet impact. Adult day centers provide daytime care, supervision, meals, and activities, offering relief for caregivers and engagement for seniors. Shared housing, where older adults live together or with younger people in intergenerational homes, is another growing trend, reducing both isolation and cost. Some families are exploring caregiver co-ops, where multiple households rotate care for a group of seniors, or pool funds to hire a shared nurse or aide. These models aren't mainstream yet, but they show what's possible when communities come together, when elder care stops being a private burden and becomes a shared responsibility. Still, none of these options can fix the bigger picture alone. What's needed is policy reform, tax breaks for family caregivers, increase Medicaid support without forcing people to lose everything first, incentives for affordable long-term care insurance, investment in training and wages for elder care workers, expanded respite programs so caregivers can rest without guilt or fear. But reforms don't happen in silence. They require voices, caregivers willing to speak up, families who share their stories, communities that organize and push for change, not just for their own parents, but for future generations who will one day face the same road. Because the real solution, it's not just in insurance forms or state funding, it's in shifting the narrative so that aging isn't a financial catastrophe waiting to happen, but a natural, supported phase of life. It means building a culture where we plan for care, not scramble for it, where we value caregivers as essential, not invisible, where dignity doesn't depend on income, and no one has to choose between their parents' well-being and their own future. No, we may not fix this overnight, but every conversation helps. Every resource shared, every policy challenged, every neighbor who checks in on an elderly friend, it all adds up. And maybe that's where the hope lives. Not just in one big fix, but in 1,000 small shifts towards something better. something more humane, something that finally says, we see you, we hear you, and you don't have to do this alone. Caring for the people who raised us shouldn't mean going bankrupt. And yet, for too many families, that's exactly what's happening. We've created a reality where love and loyalty come at an unspeakable price, financially, emotionally, and sometimes physically, where the decision to care for mom or dad quietly unravels retirement dreams, college plans, and personal health, all while the system looks the other way. But this isn't just a policy issue, it's a human one. It's what happens when a society fails to prepare for the very thing we all hope for, a long life. There is no one-size-fits-all answer, but there is one universal truth. We cannot carry this burden alone. Families need to start having these conversations early, before a crisis hits. Talk about preferences, paperwork, budgets, and boundaries. Explore community programs, ask about state resources, and don't be afraid to ask for help. It's not weakness, it's wisdom, because the earlier you plan, the more options you have. And if you're already in the thick of it, already juggling appointments, medications, and bills, you're not alone. There are more of us out there than you think. Caregivers, advocates, children doing their best. We need each other. We can't fix the entire system overnight, but we can support one another. We can share resources, we can speak up, and we can demand better. Not just for our parents, but for ourselves and the next generation. Because we can't keep going broke to care for our elders. The system must change, but until it does, we need to protect each other, one family at a time. So if you're exhausted, unsure, overwhelmed, take a breath. You're doing one of the hardest, most important jobs there is, and you deserve to be seen, supported, and sustained. Let's keep talking, let's keep pushing, and let's never forget the strength of a society isn't just how it treats its young, it's how it honors its aging. If this video helped you feel seen or helped you understand what someone else is going through, don't let it stop here. Share it with your family. Start the conversation. You never know whose burden it might lighten. Subscribe to Elderly Truths for more real stories, honest reflections, and resources for the journey we're all walking together. And if you're a caregiver or someone caring for a caregiver, thank you. Your love is quiet, steady, and deeply powerful. You're not alone. You're not invisible. And you deserve support just as much as you give it. And we'll see you in the next video.